Right now, suicide is the second leading cause of death in our youth ages 10 to 17.
And so it's a really important moment in time for us to think about how we can prevent suicide, how we can detect those individuals who are at greatest risk, and how we can apply interventions to really improve the outcomes for everyone.
The STARRS PC study, it stands for a stepped approach to reducing risk of suicide in primary care.
The STARRS PC study is one of the projects within the Center for Suicide Prevention that focuses on what primary care pediatricians can do to help identify suicide risk in adolescents 12 years and older, and to implement evidence-based strategies to help improve outcomes.
The primary care office is hopefully their medical home where they really trust the doctors or the other providers. So it's a safe place for them to truly tell us how they're feeling.
When we screen for anxiety and depression with our youth, we do it with questionnaires. Those questions just about general depression and anxiety can miss thoughts of suicide. So we're adding an additional questionnaire that targets more of our thoughts of thinking about killing ourselves. The form we use is called the ASQ, and it's a 5-question form that the adolescents fill out themselves, and they get an answer privately, and then we review it and we discuss it with the families. So if somebody were having these thoughts about maybe wanting to be dead or thoughts about self-harm, then we go through a much deeper survey called the BSSA, which is longer, where we get a more in-depth history about how often are we thinking these things? Do we feel we're worsening? Or was it remote history? Are we doing okay now? And then one of the big questions we ask on the form is, are you having thoughts of suicide now? And if so, things escalate where we're talking about immediate mental health crisis intervention.
The universal screening that we've been doing pretty much just helps open the door. So sometimes even if they don't seem as if they are at risk, they could still have those feelings, but they just don't know who to ask, who to talk to, or what the words are for their feelings. So the screening kind of helps them with that.
As part of the STARRS PC project, the research team is following up with everybody, the clinicians and the patients and the patients' families, to find out what's worked and what hasn't worked, so that the other practices involved can learn from those lessons and continue to get better in this difficult work that they're doing.
I'm really glad we got involved with the STARRS study. Screening for anxiety, depression, suicide, thoughts of self-harm. It shouldn't just be, can we do this? Should we do this? It should be, we have to be doing this right now.